Welcome and thanks for joining us. My guest today is David Merritt, the Senior Vice President for External Affairs, Blue Cross Blue Shield Association. David, thank you so much for talking to us today.
Thanks, Nick. Appreciate you having me.
We're going to talk about healthcare affordability, which is something we can all relate to. It can get pretty expensive, and everyone can face challenges with that. When it comes to Blue Cross Blue Shield companies, they've been at the forefront of the discussion around healthcare affordability. What makes them uniquely positioned to have a real, meaningful impact in this space?
Yeah, rising healthcare costs are a financial anchor for too many Americans, and it's been a financial anchor for too long. You think of the mom who doesn't pick up a prescription drug for her kid because she can't afford it. The worker who skips a trip to the doctor's office when he really needs to because he can't afford it. The business that doesn't expand and create jobs because healthcare costs are eating into the bottom line. These are the consequences we see of rising healthcare costs that happen every single day. Blue Cross Blue Shield companies, we cover, serve, and support 118 million people across the country. 5 million people, actually, federal employees and their dependents, we cover. We're a partner when it comes to healthcare. We're a leader when it comes to healthcare affordability. We've been bringing solutions to the table because we know that it hurts the people that we cover. So we feel a responsibility really to take on this crisis.
And you mentioned that you're everywhere. You are in every part of the country, and this is something that touches everybody, healthcare affordability. It's something that none of us can escape from, really. At some point, we're going to have to pay for healthcare. That's something we all have in common.
Well, and that actually takes a responsibility for everyone to address the crisis together. No one can really solve it alone because the system is so interconnected. So you need private sector leaders like Blue Cross Blue Shield, you need government leaders, you need physician leaders, hospital leaders to come together really to address this crisis together. The thing to keep in mind is that what medical care does, from crutches to flu shots to cancer treatments, emergency surgery, all of that is reflected in what we pay in premiums and out-of-pocket costs. And so if the prices go up for those services, the prices for premiums go up as well. And so that's why we have such a responsibility to address what goes into those healthcare prices. A good example is regulation. Regulation protects patients in innumerable ways. But at the same time, if regulation is overburdensome, it's too expensive, if it's too complicated, we know that that also increases the prices that patients pay as well. And so we were happy to see the Trump administration actually take on over-regulation and look to pull back the number, the size, and scope of regulation. That's a good step in the right direction. But more needs to be done, and that's why everyone really has a role to play to bring down prices. Because, again, the higher the price for delivering care, the higher the price insurance that patients pay.
And you just mentioned the federal government, the Trump administration. When you look at public and private sectors, who bears responsibility for the cost of care? I guess, is it equal? Is it public and private equal, or is there one side that takes on more responsibility than the other? What do you think?
We're all in it together, truly. It's an interconnected system. It's a $5 trillion a year system. And we all have a part to play, not only in getting patients the care that they need, but getting patients the care that they need at a price they can afford. And so that's why we really need to come together, both public sector, private sector leaders, including Congress, including policymakers. There are solutions that we can pursue that can actually bring down the cost of delivering medical care, which would then bring down the cost of covering that medical care.
So Blue Cross Blue Shield published a roadmap with solutions to save about $1 trillion over the next decade. When you look at that roadmap, can you walk us through some of the solutions that you think have the greatest potential for savings?
Sure. It's a roadmap to reduce costs, and even in Washington, D.C., $1 trillion is real money. We know that that's the price that is paid by patients, businesses, and taxpayers. There are three real big solutions that we look to for this savings. The first is around hospitals. So hospitals account for more than half of all healthcare spending. And when you spend $5 trillion a year, you're talking $2 to $2.5 trillion being spent in a hospital, the most expensive place to get care. There are effective solutions, I think common sense solutions, that can actually bring down the costs that hospitals charge, that can save upwards of about $500 billion. The second area is around prescription drug pricing. We've seen, the out-of-control prices from Big Pharma for a number of years. And we think if you introduce more competition to the marketplace, you get more choices for patients. And when you have the combination of choices and competition, that always brings down costs. And then the third area is around consolidation. Consolidation actually constrains choices and limits competition. So we think taking that on, not only in the pharmaceutical space, but also on the corporate health system side, when you have more choices, you will have more choices at lower costs. So those are the three big buckets that can get you to that $1 trillion in savings.
When you talk about hospital billing and you speak with lawmakers, policymakers about that, what do you say about hospital billing to those people who craft legislation, make decisions on this? What do you say to them about the importance of this potential savings around hospital billing? Why should they care about it?
Yeah. The first thing we say is just to recognize the value that hospitals play. I mean, we all know the value they bring to patients. They save lives. When we're sick, they get us healthy. So we always have to recognize the vital role they play when it comes to healthcare. It is also a fact, though, that more than half of all healthcare spending happens in a hospital. It can be more efficient, it can be more effective, it can be targeted. And we think that that is where we need to start because there's so much savings to be had in the hospital setting. And when policymakers hear from their constituents, overwhelmingly what they hear about is, I can't afford my health care. And so there are two ways that we look at healthcare affordability and fair and reasonable hospital billing. Facility fees are something that hospitals have increasingly used in recent years to just tack on additional fees when they treat a patient. So it could be a couple $100, it could be a few $1,000s, but it's not tied to any particular service or procedure. It's literally just a markup. And this can cost patients, hundreds or thousands of dollars. The second is around the variation between sites of care. So the hospital is the most expensive place to be treated, but they also charge 5 to 7 times more than just getting the same service done in a physician office. So when you have that much variation, you're talking hundreds of billions of dollars. And so lawmakers are increasingly looking at the hospital as an area for savings because we spend so much and the prices are too high.
Right. Site-neutral payment policies. Now, not everybody knows what that means, but that's really important. So let's talk about site-neutral payment policies and how they impact health insurance premiums and out-of-pocket costs for patients. Site-neutral payment policies. First of all, what is that? Let's walk through that first.
Sure. Site-neutral policy is really meant to protect patients from paying higher costs simply because they were treated at a hospital versus a doctor's office. When a hospital buys a doctor's office, you could be seeing the same doctor, the same nurses, using the same technology, but because the name on the door changed from independent physician office to now hospital outpatient department, you could be paying 5 to 7 times more for the same exact service that you've always had. So that's why site neutral, which seeks to standardize the variation between those sites of care, is so important. And we're not talking, rare diseases or rare procedures.
Right.
We analyzed tens of millions of claims over the last few years. And what we found was procedures like colonoscopies, x-rays, MRIs, they can be 5 to 7 times the cost at a hospital versus a doctor's office. And again, wow, you're using the same technology, roughly the same staff, getting the same outcomes, same results, but it costs 5 times more. Wow. It just doesn't make any sense.
And so the idea is to create a policy or ensure in some way that you pay the same amount no matter where you go, right? That's the idea?
Correct. And for patients who are on Medicare, patients who are on their employer's plan, if the cost of seeing a doctor is 5 to 7 times because you're at a hospital, that simply raises premiums. And so if you can standardize that and bring those costs down, you can actually bring the cost of premiums down. And what that helps patients, consumers, businesses, and taxpayers.
So site-neutral payment legislation, is that going anywhere in Congress? Do you have optimism that it's going to be something you can advance and move forward with in Congress?
Absolutely. I mean, even in the polarized politics that we have now, this is one of the bright spots of bipartisan support. Last year it passed the House. Didn't make it in the Senate, but did pass the House overwhelmingly, actually, bipartisan support. And in the Senate this year, there are two bipartisan leaders. There's Bill Cassidy, Republican senator and doctor from Louisiana, and Maggie Hassan, Democrat from New Hampshire. Strong leadership, bipartisan leadership, because again, it's common sense. We don't need to pay 5 times more for a procedure or an x-ray simply because of where it's delivered and where it's done. So we're hopeful that delivering that level of savings that can deliver that relief for their constituents, we think is generating some bipartisan momentum. And when Congress right now is looking at savings, when they're looking to cut coverage in Medicaid and the ACA, we think it's a much better approach to look at these types of solutions that can increase competition, increase choice, and bring down costs and actually bring down premiums for patients.
All right, and that's another thing that impacts really everybody at some point. All right, David, thank you so much. We appreciate it.
Thank you, Nick. Appreciate it.
That is David Merritt, the Senior Vice President for External Affairs, Blue Cross Blue Shield Association. I'm Nick Iannelli, and for more information on this series, go to WTOP.com and search the Healthcare Agenda.